So hello friends, welcome back to my channel Medicine of 101. Today we'll talk about acute pericarditis part 2. So I have already uploaded one video based on the acute pericarditis part 1 where I have just explained all these things in terms of the infective regions. Now as far as the etiological classification is concerned of the acute pericarditis, I just described over there in the three classifications. I just said for the infective, second I said the hypersensitivity mediated pericarditis, and the third is miscellaneous. That means that may be the non-infective, or we can say the non-hypertensive, non hypersensitivity mediated. We can say non-hypersensitivity mediated or non-infective mediated. Now, first regions I already described over here. Okay, as for the infective. So, infective pericarditis, what I have already explained. There I said in terms of the bacterial regions, in most cases the viral, fungal, okay, in these cases. Now today's focus only on hypersensitivity mediated pericarditis, okay, pericarditis. When you are talking in terms of the hypersensitivity mediated pericarditis, at the time what type of the disease or the etiology you can get over here, just try to make a list of them. So when you are talking in this way, we know as that we'll get the SLE, systemic lupus erythematosus, we can get over here. We'll also get the rheumatoid arthritis. We can get the scleroderma. Okay, these three regions, these three etiologies will be remembered first. And if we see the topmost regions over here, what will be the main regions over here? There is the rheumatic fever. So what is the rheumatic fever? Now, how can we define the rheumatic fever? Okay, what is rheumatic fever? So whenever we will see that, try to understand, when you see that multi-system immune-mediated inflammations in rheumatic fever, what type of the thing will get over here? That will get the multi-systemic immune-mediated inflammations. So if you write it over here, what's the main thing in terms of the rheumatic fever? We will write in this way. There's the multi-system. We can say multi-systemic. Okay, immune-mediated inflammation. And I hope that all of you know it was the main agent for it. That's the post-streptococcal. Okay, so if you write it over here, let's write in this way. In these cases, we'll get the post-streptococcal antigens, right? Whatever the antigens, we'll get the post-streptococcal antigens over here. And we'll see these antigens that will be spread in the different parts of the body. Basically, we'll see where within the skin. Within the skin, it can cause infections over here. So whenever it will cause infection within the skin, that will develop the erythroma over here. That can also cause the problem within the central nervous system, especially within the cerebellum. That can cause the chorea. As far as the subcutaneous tissue is concerned, we can also get the problem there. We can get the formations of the nodosa. And we also see where the problem within the synovial joint, they will get the arthritis. And we will also get the problem where we will get the problem that was also the infections where, or the inflammations were within the pericardium. So whenever we will see the inflammation within the pericardium, that will cause the pericarditis. Now for the same thing, for the same region, we can also see the development of the myocarditis and sometimes even the endocarditis. So in these cases, we can get the pericarditis. We also see sometimes the myocarditis, and also sometimes we can see the development of the endocarditis. Okay. Now this is the one region. So in terms of, as far as the rheumatic fever is concerned, we can say in this way. Now there are certain types of the drugs that can also cause the pericarditis, and those group of the drugs known as HIP. Now there are certain kinds of the drugs. This drug is known as HIP group drugs, HIPPP. Now what are those drugs? So H for over here, you have to write in terms of hydralazine. See, then I for isoniazid, Right. Then what? One P, the first P, the distance for the penicillin. Then this P for the procainamide. And this P, the distance for the phenytoin. Phenytoin. What did I say? There are certain types of, some groups of the drug, they are known as the HIP group of the drugs. They can also cause the pericarditis. In terms of the, if I say the what is HIP, H stands for the hydrogen, I stands for isoniazide, this P, the first P stands for what? The penicillin, then P, what it stands for procainamide, and the last one phenytoin. I am repeating once again. We will get the drugs hydrogen, we can get isoniazide, we can get the penicillin, we can also get the procainamide, we can also get the what? Phenytoin. Okay, this group of the drugs, they can also cause the pericarditis. So this is a drug induced development of the pericarditis. Now the other causes for it. What are the other causes? So let's write it over here. So sometimes we see, try to understand, and if we see the inflammations, try to understand over here. If we see for these things within the, if we see the development of the pericarditis, okay, if we see the mild pericarditis, try to understand, if we see the mild pericarditis, at that time within the pericardium we will get the serous fluid, right? Serous fluid. If we get the mild to moderate, I have already explained how these things are, getting formed over there. If we get the moderate inflammations within the pericardium, we will get over here the fibrinous pericarditis. And if we get the severe over here, then we will get the hemorrhagic. We will get the accumulations of the blood within the pericardium. Hemorrhagic. Okay. Now sometimes you can see whatever the regions, if we if we see the damage on the heart, if we see the damage on the heart, so whenever we, for example, the damage within the heart, if we see, for example, in terms of the endocardium, sometimes we can see the damage, for example, okay, let's draw on part over here, then I think it will be easier for you to understand. Okay, let's make it in this way. Okay, now see, and around it we will get the pericardium, right? Around it we will get the pericardium. The pericardium and the inner structures. For example, I am just considering this is the myocardium, this is the endocardium, and the outermost layer there is the what? Epicardium, right? You know it's epicardium. Now, for example, so we are getting the injury. If we get the injury on the heart, it means in terms of the traumatic regions. So if we write it over here, it's not working. Let's use the different one. If we get the traumatic situation, what type of thing we'll get? Whenever we get the traumatic situation or the physical injury with the heart, for example, if we get the problem over here, sometimes you can see, definitely there will be development of the inflammations for the for the development of the trauma. Whenever we get the traumatic injury over here at that time, definitely this portion that will go under the inflammations, and from here we can see the inflammations that can go through, and that can also develop the pericarditis. Okay, the first thing. The second reason we can say in terms of the post-cardiotomy. Post-cardiotomy. For whatever, any kind of the surgery, if we see within the heart, if we get, if we just do the surgery within the heart, after some days, for example, after, 1 week, we can also see, for example, if we get, after just completing the cardiac surgery over here, if we get, the problem within the pericardium, that means in terms of the pericarditis, then this type of the inflammations we will see within the pericardium for post-cardiotomy, that means after doing the surgery over here, okay? Then I said in terms of the traumatic situations, another in terms of the post-cardiotomy. Now the other regions, okay, that is known as Dressler syndrome. So what is Dressler syndrome? You have to know in details about it. Dressler syndrome. Okay, let me use this color for it. I don't know, it's not working. See, okay, let's use this one. One thing I have to mention so on here, try to understand, if we see for the traumatic situations, if we see within 2 to 3 days, if we see the development of the pericarditis, This will be for the physical injury within the heart. Okay. And if we see the development of the development of the pericarditis over here for the traumatic injury after 1 week or 2 weeks, that will be immune based, that will be immune mediated. In the same way, within the post cardiac always thing, try to understand if we see after just doing the surgery within the heart, if we see within 2 to 3 days, that means from 24 hours to 72 hours, within this duration, see if we see any of the inflammation within the pericardium, that will be not immune based, that will be just for what? For the we can say in terms of the post cardiotomy. Within the post cardiotomy, that may be for injury based, but that will be not the immune based. Now, what is Dressler syndrome? Just to understand the Dressler syndrome, I have to draw one more portions of the heart over here. Okay, try to understand from these portions. If we see there is a development of the transmural myocardial infarctions, for example, anybody or you can say any individuals who develop that transmural myocardial infarctions, whenever that means across this myocardium whole, okay, these portions. If we see, try to understand, if we see the transmural infarctions over here, so whatever the chances we will get over here, there is a chances for the necrotizing components or the necrotizing chemical mediators. For example, just consider this is the pericardium. Try to understand. So whenever we see this way, that you are just we are getting the development of the transmural myocardial infarctions. As a result, we will see there is a chances for this necrotizing chemical mediators to go from where? From these portions to these portions. So if we see, for example, today I just developed the myocardial infarctions. After 2-3 days, for example, if we see after 2-3 days, chemical mediators, that means the necrotizing chemical mediators, they are going from the myocardium to the pericardium, and after going there, this necrotizing chemical mediators, they are causing the inflammations within the pericardium. Okay. Now if we see after 2 to 3 days, now this type of the thing that is not Dressler syndrome, it is that for the direct extension of the, if I can write in the better way, for the direct extension of necrotizing chemical mediators. Now, if we see, for example, try to understand from here, we are getting the transmural myocardial infarctions over here. Now, as we know, by within the circulations, we will see the antigens within the what? The myocardial antigens, where we are getting the development of the myocardial infarctions from that portion myocardium, we'll get the myocardial antigens. So we'll get the myocardial antigens over within the circulation. So for example, we are getting the myocardial antigens over within the circulations. Now whenever we will get the myocardial antigens from the myocardial infarctions portions of the myocardium, so whenever we get the myocardial antigens over here, against these antigens, our immune system that will be activated, and our immune system that will produce the antibody. Now this antibody, definitely we are getting the antigens over here, so definitely this antibody they will come over here, and try to understand from here. Along with that thing, we will also this presence of these antigens. Try to understand when you are talking in terms of the transmural, myocardial infarctions. At that time, these antigens they will be not locating within the myocardium. Instead of that, they will be also circulate over within the pericardium, and from the pericardium they will be also transported to the what? For example, within the pleura, within the lungs. So if we see the, okay, let's draw it over. I think that it will be better for you guys. For example, okay, let's draw it once more. Okay, let's draw in better way. Okay, now try to understand. We are getting the development of the myocardial infarctions over here, and these are the myocardial infarctions regions. And for example, is the what? Pericardium. I have already mentioned these things before as well. We are getting the pericardium over here. Okay. Now, and for example, this is the lungs. And this is the pleural cavity. Let's show the pleural cavity with a different color. Okay. Pleural cavity. Okay. Now we are getting the transmural. Try to understand, we are getting the transmural myocardial infections over here. And whenever we will see these antigens, they can be spread from here, from the myocardium to the pericardium, and from here we can see also the antigens over here, and from here we can also see the antigens that can go in the lungs also. Now try to understand how can we define the Dressler syndrome. Okay, I am repeating once again. So what? How can we just define the Dressler syndrome? So whenever we see the development of the infections, for example over here, so after within after 2-3 days we will see whatever the thing we will see that these antigens from the myocardium, that will be taken by what? The circulations. So within the circulations, this antigen, they will reach over here. So whenever we see the antigens within the circulations, myocardial abnormal antigens, that means infected antigens over here, and against these antigens our immune system, that will be activated. And whenever the immune system, that means in terms of the immune headquarters, that will be activated, at that time they will produce the antibody against these antigens. So whenever after just producing this antibody, try to understand this antibody, they will come over here, they will come over here, they will come over here, they will come over here. So whenever they will attack over here, they can also develop the pericarditis, they can also develop the inflammation within the pleural cavity, they can also cause the pneumonitis, that means what? Within the lungs. So how can we just define the Dressler syndrome? Let's repeat once again. So whenever I am saying that we are developing we are just saying the development of the what? Myocardial infections, transmural myocardial infections. As a result, we will see within 2 to 3 days, this myocardial from these portions we will see the antigens that will be taken by the circulations. So whenever we will get the antigens within the circulations, we will get the productions of the antibodies. Now these antibodies, they will be presented where on the where the within the infected portions. Along with that, we will get the antibody within the pericardium. Along with that, we will also get the antibody within the pleural cavity, and also we will get the antibody in the lungs. So this type of problem we will see as far as the Dressler syndrome is concerned. Now see, whenever I am talking this thing, that it is immune based. So immune based or immune mediated, this type of the problem things, it will take time, right? It takes time. It takes time to develop the what? Pericarditis. But in this case, see, if you see the development of the if you see the development of the myocardial transmural myocardial infections over here, if you see the direct extensions of the antigens from here to here. So within, for example, I have developed the myocardial infections today. So after 2 to 3 days, for example, within the 24 to 72 hours, I can see the develop. If you see the development of the what? Pericarditis. If you see the inflammation within the pericardium after 2 to 3 days after developing of the what? Transmural myocardial infections. At that time, we can consider this thing for the direct extensions of the myocardial chemical mediators. So you can see in terms of the antigens. So it's better to say in terms of what? Necrotizing chemical mediators. So whenever we see the direct extensions of the necrotizing chemical mediators from the transmural myocardial infected area within the pericardium, after going there, we'll see the development of the inflammations within the pericardium. So we can say we'll get the pericarditis for the development of the transmural myocardial infections over here. Okay, now we'll talk about the other causes. Now, the other classification, as I said you over here, what are the other causes? The other causes, okay, it's non-hypertensive mediated, non-hypertensive, it's not hypersensitivity mediated, hypersensitivity mediated or non-infective. Now in these cases, when you are talking non-hypersensitivity mediated or non-infected mediated pericarditis, the most common cause you will get over here, what's the acute? You get the acute myocardial infections. So whenever we are getting the acute myocardial infections, try to understand. So in these cases, from whenever we are getting the acute myocardial infections, definitely in these cases, whatever the thing will see, the antigens from the myocardium, or you can say the necrotizing chemical mediators from the myocardium, they will go over within the pericardium. So whenever they will go within the pericardium, acute, that means it will not take that much time. It will cause the inflammation within the pericardium within 2 to 3 days. So here you will get what? Inflammations over here. We get the inflammations. But we have to understand one more thing over here, that if we see the development of the pericarditis, if we try to understand, if we see the development of the pericarditis for the development of the acute myocardial infections, at that time we are not supposed to use the non-steroidal anti-inflammatory drugs. What I am saying, try to understand, if we get, okay, I am writing it over here, if we get acute myocardial infarctions. Okay, let's try it over. If we get pericarditis, acute pericarditis. I'm writing A stands for acute. Okay, if you get acute pericarditis, for the development of acute myocardial infarctions, at that time we are not supposed to use non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. We are not supposed to use. Why? Try to understand. If we get the development of the pericarditis for the development of acute MI, that means acute myocardial infarctions, at that time, just to treat the pericarditis, we are not supposed to use the non-steroidal anti-inflammatory drugs. Why? If we use the non-steroidal anti-inflammatory drugs, they will do what? They will just inhibit the scar formation. Will inhibit scar formations. So whenever the scar formations that will be inhibited, and along with that we will also get the chances for the heart rupture. We will get what? The cardiac rupture. A rupture for the heart, that will be increased. The chances for the rupture of the heart, that will get increased. So we are not supposed to use these drugs. Normally, what do we know? That whenever we will see, try to understand, if we see just normally isolated, if we see the isolated development of the pericarditis, at that time normally what we use? We use the non-steroidal anti-inflammatory drugs. But in these cases, we are not supposed to use. Along with that, whenever we see the development of this type of the pericarditis, we are not supposed to use what? The anticoagulants. So because in these cases, we have to also avoid the what? Anticoagulants. Why we avoid the anticoagulants? Try to understand from here. For example, okay, let me show over here. So whenever we're using the anticoagulant, at the time, for example, it's the pericardium. Is the pericardium, we are getting the development of the, for example, the myocardial infarctions in these regions, and for that we are getting the development of the what? Pericarditis. At the time, if we use the anticoagulant, whatever the thing we'll see over here, we'll get the bleeding. That means we'll get the accumulations of the blood within the pericardium. This blood vessels, from here we'll get the accumulations of the blood within the pericardium. So whenever we will see, for using the anticoagulant, understand, for using the anticoagulant, we will see the accumulations of the blood within the pericardium, that will develop the cardiac tamponade. That means this thing that will compress the heart. So whenever we get the compressions of the heart, for using the anticoagulant drugs, okay, in treatments of what? Acute MI. So in these cases, try to understand over here. So whenever we see, okay, so whenever we're using the anticoagulant drugs over here, so for using the anticoagulant drugs, we are getting the accumulations of the blood where within the pericardium. So whenever the blood within the pericardium, that will be increased, the pericardium, that will compress the heart from all sides. So there is a chances for the development of the cardiac tamponade, that can cause the death of the individual also. Okay, so we have to make sure over here that we have to avoid what? The anticoagulant drugs in these cases. So let's write it over here. Okay, we'll get the accumulation of blood. So as a result, that will develop the cardiac tamponade. Cardiac tamponade, that will as a result of the result to doing these things. So we are not going to use this drugs over here. Okay. What are the other causes? What are the other causes that can cause this type of problem? Now we can say in terms of the uremia. The other causes we can say in terms of the uremia. Now how uremia will develop this type of thing? Urea means what? Whenever the kidney, or you can say the renal function, is not done properly. If we see, for example, the renal function, the kidney are not functioning well. At that time, we will see the accumulations of the what? Uric acid over here. We can see in terms of the blood within the what? The blood, the amount of the nitrogen, that will be elevated. So whenever we will get the elevated, okay, let me check it once. Okay, let's continue. So whenever we will get the elevations of the uric acids over here, in whatever the thing, the accumulated, these wasted products, that can irritate the pericardium. So whenever it can irritate the pericardium, that can also development of the pericarditis. That can also do the pericarditis over here. And apart from the uremia, the neoplasia. So then we have different kinds of the tumor, development of the different kinds of the tumors that can also cause the pericarditis. How? If we see the bronchogenic carcinoma, try to understand. If we get the development of the breast cancer, or we can see the bronchogenic carcinoma, from the here we can see that by the metastatic process we can see the different kinds of the neoplastic cells they can arrive within the pericardium and they can cause the pericarditis over here. So in terms of the bronchogenic carcinoma, okay, in terms of the breast cancer. Now one interesting thing I'm going to say you guys, try to understand from here. For example, an individual who has developed the myocardial infarctions, earlier myocardial infarctions, that means we are getting the myocardial infarctions in the early stage. So if we see the early development of the myocardial infarctions, at that time how should we manage the patients, right? So if we see in terms of the just to treat the early development of the myocardial infarctions, in these cases what we are supposed to do, we have to use the reperfusion therapy. We have to use the reperfusion therapy. So for example, an individual who is developing or who has developed the myocardial infarctions over here in the early stage, if we get the development of the myocardial infarctions within the early stage, at that time myocardial infarctions in early stage. Now at that time what we have to use, try to understand. Now if we get the development of the myocardial infarctions in the early, if we just come to know that the individual is having the myocardial infarctions but that is in the early stage, at that time you have to use what? Reperfusions therapy. You have to use what? Reperfusion therapy. Why? Whenever we use the, try to understand, whenever we use the reperfusions therapy, at that time we will see the blood, whatever the blood flow that will come over here. In these cases that will dissolve the what? Thrombolytic agents. That will dissolve the thrombolytic agents. Along with that, it will also supply the blood in these portions. That means these regions also. So whenever it's infected area, that will be also supplied. At that time, these regions, that will be what? They will get the recovery of these regions. So whenever we will get the recovery of these regions, or within the this part, that means within the, along with the what? The epicardium part. That means the distal part. Whenever we will get, that is getting removed from the infected zone. At that time, there is a less chance for the development of what? Pericarditis, because for using the reperfusion therapy, whenever these regions that will be spared, whenever these regions will be spared, or we will get what? The removal of the infected zone from here at that time. So these regions will be normal. But whenever these regions will be normal, at that time there is a very less chance just to pass the necrotizing cells, or you can say the infected antigens or whatever chemical mediators from these regions to the pericardium. So the very less chances for the death of the pericarditis for these things. So these are all about in terms of the different kinds of the regions. Now in the next video, we'll talk about how can we manage in the different types of the things. So if you get the pericarditis for the development of the, for example, the ACD, how can we treat? If we get the for other regions, for the bacterial, we have to what are the antibiotics, we have to anaphylactics we have to use over here, and we can say, for example, if we see the development of in terms of the for using the different kinds of the drugs. For example, I have already explained over here. We can use hydrogen, isoniazid, penicillin, procainamide, and also phenytoin. Now, how can we avoid these drugs, and how can we just apply the antidote against these drugs? So we'll talk about all these things in the subsequent parts. Okay, so this was all about in terms of the acute pericarditis part 2. In the next video, we'll see you soon. And thanks for watching.